It's time for health tips. Now here's your host, Dr. Alma Jenkins.
Good evening. I'm Dr. Alma Jenkins, and I want to just welcome you to Health Tips. Thank you so much for watching. Well, what will we talk about tonight? It's November, and it is amazing to think that so much of this year has gone by already. Many of you probably have, goals that you thought you'd reach by now. Well, take heart. There's still some time left in the year, and if you don't accomplish everything now, put it on your to-do list starting 2017. Let me invite you to let us know if you'd like us to speak at your church or your organization. We would love to come and talk on a topic of your choice. It doesn't have to be a gastroenterology topic. It could be any medical topic. And we are looking to expand the show to include some other aspects that still deal with your well-being. So stay tuned. This month, the month of November, is a month that follows, of course, the month for breast cancer awareness, October. So you might wonder, okay, what is this for? The month of November is a month for three things, among other things. If you look it up, there are many things that it can be known for. But one is American Diabetes Awareness Month. 2, Prostate Cancer Awareness Month. And 3, National Hospice Palliative Care Month. So I want to say a little bit about each one of these three things because whether you recognize it or not, you probably know someone with any of these three things. Now, when I say whether you recognize it, I mean the last one that talks about palliative care. And I'll explain what that means, and then you'll be real familiar with it. But let's start with American Diabetes Awareness Month. Now, many of you are not aware that you may be diabetic. What should you be thinking about, or what should you be concerned about in terms of diabetes awareness? Well, this brings to mind a true story when we first started doing the health fair at St. Mark Church right there on Ash Street. So this was maybe early on when we were doing the health fair there, and we would have it right on the campus of the church. And we had one member of the church who brought her grandson and said, he's been getting up at night to go get water. He can't get enough water to drink. And so we checked him, and he was a diabetic. In fact, his blood sugar was so high, we sent him to the emergency room. And that was the beginning of his knowing that he had diabetes. I think he was maybe 11 or 12 years old at the time. He's a strapping adult now and doing very, very well. So one of the things that you can be aware of, or that you should be, how should I say, these are the risk factors, let me say, for diabetes. Number one, a family history of diabetes. So, and that's probably the biggest risk factor that I can think of, is if you have a family history. Mom and dad had it, there's a great chance that you will have it. Or, your blood sugars are elevated, and this doesn't include a fasting sugar, so they're going to want to do a fasting blood sugar. And I won't call this a risk factor, I will just say some symptoms may be. You have a great thirst. You just can't seem to get enough water. You might be fatigued and don't know why. You've been sleeping, but you're still really tired. Okay. Those are some common ones that I can think of. What should you do if that's the case? Well, if you have a strong family history, you've been feeling tired, you've been really thirsty, you've been losing weight. I'll never forget, I had a patient who was losing lots of weight, tired. This person turned out to be a diabetic, had a family history as well. Then you're going to want to see your primary provider and get a fasting blood sugar, and they'll know where to go from there. But you know, if you are diabetic, one of the things that you should never do, and this is bad to do anyway, but smoking. I'm always concerned when I see diabetic smoking. It's bad for anybody, whether you're diabetic or not, but it's certainly a worse risk factor for heart disease if you're diabetic and a smoker, because each one of those carries their own risk for heart disease. So you are double loading your gun to your head if you're diabetic and you smoke. If you look at pictures of twins, which I've seen, who they looked at that to get some idea as to the effect of smoking on, say, general appearance. One was diabetic, one was not, one was they were identical twins. So the one that smoked over the years aged a lot faster than the one who didn't smoke, because you don't get great circulation to your skin. The smoking sort of constricts your blood vessels, and then diabetes can affect your blood vessels. So you put that together, and there's a great chance of circulatory problems. So the aging process speeds up. So, you know, we women are often concerned with that factor. So I just wanted you to be aware of that. And we just came out of, we're now in lung cancer prevention month. You've seen that show. So that we're coming right on the heels of that. So I didn't say anything about lung cancer for November, but it's also Lung Cancer Awareness Month this month. But since you saw that recently, I focused on the other three. So what if you find out that you are diabetic? What should you do? Well, number one, let's start looking at your diet. You know, the diabetic diet is actually just an overall healthy diet anyway. You may need to get a dietitian consult. There's nothing wrong with asking your doctor to give you a dietitian consult, because she can help get you on a good diet, help you make out your menus so that you stay on track. Because if you don't, then you have a risk of developing heart disease, kidney problems. Many of the patients on dialysis are diabetics. You have a greater chance of having a heart attack. We want to keep those vessels as clean as we can. So that means, ladies and gentlemen, that when you go to the buffet, you're not going to get those fat meat skins. You're not going to try to, get those things that are heavy in the grease. And you're going to try to keep your meat consumption down. That is a side dish rather than a main dish. And I think that's where we make our mistake. Our big thing in our meals is the meat, and everything else centers around that, and you're going to have a good bit of that. You don't really get a serving of meat, you get a portion. How many people, how many times have you been to Golden Corral or one of the other buffets and you see somebody with a plate with only meat on it, and then they have another plate with their other stuff on there? Have you ever seen that? I've seen that, and I just hung my head. Fried chicken, other meats, all on that plate, nothing but meat. So I'm not even telling you don't have any fried chicken, because I know, every now and then you get that urge, you want some fried chicken. But is that going to be your main dish? Are you going to load up on it and have a little bit of vegetables? Or are you going to have your veggies and then a piece of fried chicken there? So we just got to think in moderation. That's the important thing. The other thing is exercise. That will also help keep your blood sugar under control. So there are many of you that haven't made that connection between keeping your blood sugar controlled and exercise, but there is a relationship. So getting plenty of exercise is very good in terms of controlling your blood sugar. Getting enough sleep, very important. So you say, what does that have to do with it? Well, that just makes you feel good in general and helps make you functional. Because if you don't get enough sleep, not only will you be cranky, but you also won't function very well. You're tired. You're not thinking clearly. And if you're like me, you have a job that requires you to think clearly, very clearly. Okay, so I've said a word about diabetes. Now let's say a little bit about prostate cancer awareness. Now we've talked about prostate cancer before, and many of you know that it's practically an epidemic in the African American population. Prostate cancer is so prevalent, and I want to make sure that our men get their PSAs. Our men who are, at least in their, for African American men in their 40s, to get their PSAs. For others in the population, I think the age may be a little bit later. But I would say, in general, getting a PSA in your 40s is a good idea. And we have reference points for what that PSA should be. All right? And also, those of you who may be having trouble, men, making your urine or, it's dribbling or whatever, you may have some prostate issues. And in the process of checking that out, they may find prostate cancer. Well, if caught early, it's like all other cancers. It's curable, okay? The key is getting to it early. So I would really encourage you to do that. And the last thing we said on our list, I keep turning that way, is this way. National Hospice Palliative Care Month. So the key here is palliative, okay? So what is palliative? Palliative means that you're not going to cure it, but you're going to manage it. You know, you've heard people say so-and-so is getting palliative care. She has stage 4, whatever the cancer is, and they're getting palliative care, meaning they're getting care that hopefully will keep that person comfortable and it will manage their symptoms, but it is not going to cure the cancer. So that's going to continue the cancer, but you're going to try to make the person comfortable. You're going to try to, treat any symptoms that they have so that they are not in pain or suffering, but you have the understanding that that is not going to cure the cancer. Or it may even extend your life for a short time, but it's not going to cure it. Now there is a place for that because we know that at a certain stage, the amount of help that we can give is limited, but there is always something that we can do in the medical field. We can provide support. We can encourage the caregivers who are dealing with patients who are getting palliative care. Many of you caregivers out there are taking care of your mom, your dad. You know that it's not curable, but you're doing your best to make their last days or the time that they have left, comfortable and as productive and memorable as possible. So let me say a few words to the caregiver, because if there's someone who's getting palliative care, that means that there are some caregivers around somewhere. Now, if you're in an institution and getting palliative care, that's one thing. But if you're at home and family members are doing so, I want to say a word to the family members. Number one, get rest yourself. One of the problems with being a caregiver, particularly of someone that you really, really care about, your mother, your siblings, your relatives, and you may be an only child, you may be the only other person in that household, your husband, your wife, and you're taking care of this person. Well, you need to get some rest, because when you're not rested, you're irritable, you worry more easily. So many things can stem from not getting enough sleep. Now that's a challenge, because when you're resting, the person you're caring for may not be. So that's one thing. Number two, realize that what you're doing may seem like a thankless position, because that person may not be able to thank you or show appreciation, but take comfort knowing that you're doing something, you're showing kindness, and that will not be wasted. That's going to come back to you. Take comfort in that. There's a scripture in the Bible that talks about, be not weary in your well-doing, because you will be repaid if you don't faint. So don't faint. Just keep at it. Keep at it every single day. And number three, don't take everything that person tells you so personally. Because they're ill, they may be irritable, they may say some things that they really don't mean. They're hurting too, emotionally perhaps. So if it's possible for you to have a thicker skin, try to do that, because it isn't what it sounds like many times, and you're undoubtedly going to experience those moments when husband or wife or mother or whoever you're caring for is not having a good day. And you're the person nearest them, so you get it. You get the brunt of it, okay? So understand that that's going to happen. Don't take it so personally, and just keep plugging away. Just keep plugging away, all right? And then lastly, just remember that some measures that you can do may not help that person. If you're faced with decisions to make, one of the things that we often have to make a decision about, or families do, that we talk to them about, is feeding tubes. Person gets so ill they can't eat anymore, and so the family wants to put a feeding tube in. And sometimes that's helpful, depending on the condition they're in. But if the person is in a condition that is without doubt going to worsen, or not going to improve, and they're in a certain way, and your doctor can help you with that. There's no way I can tell you here over the television exactly what to do in your case, but the feeding tube doesn't always provide the answer, particularly if it looks like that person is perhaps in a certain position or in a certain clinical state in their illness, that a feeding tube possibly would not be the answer. And I know to family it seems like, yeah, but we can't let this person not eat. You feel that they're hungry, and many times they're not really feeling hunger so much. So keep that in mind if you get to that point, and usually that's a point of no return, and you can talk with your primary provider to help you with that, because again, that's a state that I can't predict for you right now. It's one of those situations that is very difficult for family members. I just wanted to let you know that because it is possible to get a feeding tube, sometimes it's not really practical, and you're not being cruel if you don't do it, because that person may not have wanted a feeding tube. On the other hand, there are instances where it is appropriate. So I just want to throw that out there, because not everything you can do is something that should be done, but I hope that you have the kind of relationship with your doctor that you two can talk about it, and that you can be comfortable with the advice that you're given. A typical patient who may not benefit from a feeding tube is a person with incurable disease who now is facing the final probably the final few days of their life, you know, then a feeding tube is undoubtedly not going to help. And so don't be afraid to discuss this with your provider. And those of you who have children, discuss with your children what you think your final wishes would be, because, you know, these things come, and it's very good to be prepared. It's very difficult for family members sometimes to determine or decide what to do in situations like this. So it's kind of like having a will, and I hope most of you or all of you have a will. But if you don't have one, then you need to get one. And you probably need to get and I'm sure you need to have a power of attorney as well. Those of us who are single, and I'm still working on that even at this point in my life of making sure that all of these parameters are met. Those of us who are single, you know, need to have someone that we can depend on to handle our affairs should something happen, you know, and have a will, so that, you know, so that we know that things will be taken care of when we no longer can do it. Okay, so this is not a fun subject, I know, and it's probably something you've been meaning to get around to. I'm talking to you and to myself when I say that the more prepared you are, that's a very loving gift that you can give to those around you who are left behind. So this month, again, we've emphasized three things: American Diabetes Month, Awareness Month, Prostate Cancer Awareness, National Hospice Palliative Care Month. And I've explained what palliative means. It has to do with being able to treat but not cure. And so I hope that you've gained something from that. And we have just a few minutes now to do our exercise. Okay? And I hope that you are inviting others to watch the show. We try to give you something every week that you can kind of think about. You know, and when you think about it, think about whether any of this applies to you. And if it doesn't apply to you, it may be applying to a friend of yours or a relative. Maybe you can spread the information and help somebody with this data. We want to get the word out and empower you to take better care of yourself. So we appreciate you helping us do that. All right, let's lift our cans. 1, 2, 3, and 1. And 2, 3. You know, I enjoy this really. And I see you in the stores, and you're telling me that you're lifting your cans. Some of you are not. But I can appreciate you're watching the show, and hopefully some of this will wear off on you and you'll start lifting cans. You know, television has more commercials now than used to. So if you'll make a practice when you're sitting watching TV of lifting these cans when you're watching a show, and every time the commercial comes on, do your cans, you'd be surprised how much exercise you can get in that hour or 30 minutes that you're watching, you know, watching that show. All right. And that's one of the weight loss tips that I give to my patients, is being able to do your cans. And I tell them, just go in the kitchen and get these cans, set it down next to where you watch television, and every time that commercial comes on, get busy. All right? 1, 2, 3, and 1. And 2, 3, and 4, 5. Let's do 20 and 6, 7, and 8, 9. This really is fun. And 10, 11, 12, 13. And think how blessed you are to be able to do this. 15, 16, 17. You know, life is partly about enjoying the journey. 19 and 20. 2, 3, 4. 1, 2, 3, 4, 5. You know, you want to tone those arms up, because in the summer, next spring, you want to look, you know, buff and toned. 12, 13, 14, let's do 16, 15, and 16. Ooh, you know what? I feel that in my arms. I bet you do too. We were doing it at kind of a brisk pace, so I definitely feel it. Let's take a deep breath now. Oh, that feels good too. Hold it, hold it, hold it, hold it, hold it, and let it out. You know, try doing that all during the day. And for those of you who are sitting at a computer every day, just kind of move your head around and, you know, and get up from your desk periodically and move your legs and, you know, kind of march in place to keep that circulation going very well. All right. And for those of you who are trying to watch the weight, pack your lunch. Pack your lunch. That means do it the night before and take your lunch to work. It'll be healthier for you. You'll know about how many calories you're going to take in. And also, don't forget to pack your water. Get some water. Determine how much you want to drink that day while you're at work. And then try to finish that by the time you come home. And I know a lot of you have jobs that you hate to even stop to go to the bathroom, but it's very important. You know, we need to drink plenty of water. Keeps you hydrated, make you think better on your job, and you'll do a better job. All right? Now, I want you to let us know what we can do to help your organization. I'm going to reemphasize that because we really want to spread the word about health. Well, our time is up. It goes fast when you're having fun. I'm Dr. Alma Jenkins. Thank you for watching. Good night.